Facebook channel and on our Instagram channel. Tonight I'll be talking about heterotropic pregnancy. For those who already know what this is, listen attentively. You know what causes it, how it can be diagnosed, and how it must be sorted. So get set. I'm waiting for our YouTube family to join, and I know it's a bit late. Definitely, it's a bit late, but there's still time for us to catch up and talk about some healthy tips. We have Ajoke Kudeti, Nguma Nicole Ikuyako. We have Olayinka Adedapo, Ammonia Green Adeyinka. Thank you so much, Ammonia Green. Lovely to see you once again. And yes, so I'll start because it's late already, and I want people to get to bed on time because this is a working day. I don't want to take too much of your time. I want you to get to bed on time so we can start tomorrow with all our best energy. If this is your first time joining our channel, this is Ask the Gynecologist, and this is your number one YouTube resource where we talk about female gynecological stuff and how you can improve the health of the woman. And here, most importantly, people come asking questions about infertility, and I've ensured that over time we've covered this. And apart from that, we've also even made provision to assist people that are going through challenges of infertility wherever they might be, in Africa, outside Africa, especially for the Black women, in America, in Canada, Australia, United Kingdom, Ireland. People come all over to our center in Nigeria and they get answers to their prayer. A woman that came 5 years from the United States did a test in America today and it's positive. She did a transfer 2 weeks ago at our center in Agege, and she's back in the United States and she did the test. I'm so happy. So today I will be talking about heterotropic pregnancy. What does it mean? Easily you can go on Google and you can get the details of what it means and read about it. But tonight I'll be speaking to you from experience. So this is experience talking, and I know and have an idea of what I'm saying. Okay, now when you hear the name heterotropic pregnancy, it sounds like ectopic pregnancy. Okay, so what it means is a combination of two things. Okay, a woman has heterotropic pregnancy when she has a pregnancy, whether viable or not, in the womb, and also another pregnancy at the same time outside the womb. It could be on the ovary, it could be in the tube, it could be attached to the bowel, intestine, or even to the lungs. Is that rare? It can happen where two pregnancies occur at the same time in a woman. One is in the womb and one is outside the womb, and it could be viable pregnancy or non-viable pregnancy. Viable pregnancy means pregnancy that is alive, heart beating, and is progressing well. Unviable means it's not working well, it's miscarried. Okay, as far as there's a pregnancy in the womb or outside and outside the womb at the same time, normal pregnancy in the womb and ectopic pregnancy in the same woman at the same time, we call it heterotropic pregnancy. It's a very, very rare thing. So tonight I'll be talking about it. I'll be talking about what can make it happen, how it's diagnosed, and how it must be treated. So I'll be talking about these things tonight. So listen attentively, okay? And the most important thing you want to take out of these things is that it is an emergency, and it must be handled and tackled quickly. Okay, it's a life-threatening situation. Okay, whenever you hear ectopic pregnancy, it's an emergency. It's life-threatening. It has killed many women, and because maybe the clinician was not aware, maybe they couldn't get full medical history from the woman. For some reason, people come into the hospital, ectopic pregnancy, they have collapsed and they are near collapse. I mean, they are almost dead. They are bleeding inside, and the doctor wasn't suspecting it, or they didn't get adequate history from the woman. it was missed, it was misdiagnosed, or was missed entirely, and that person can die. Now, whenever there's ectopic pregnancy, okay, it means there's pregnancy outside the womb. Okay, outside the womb. In most cases, 80% of the time, pregnancies outside the womb are usually located on the tube, fallopian tube. Fallopian tube. So this is a sample of the womb. Pregnancy normally lives in the womb cavity. Okay, once it's outside the womb, whether on the tube or on the ovary, left or right, is ectopic pregnancy. Even it can be found on the intestine. I've seen pregnancies attached to the intestine, and the intestine is so vascularized. There's so much blood supply to the intestine. Pregnancies can attach there parasitically, and they can grow. And they can grow. So once a woman comes to hospital, you see a woman, a young lady, collapsed, moribund, not unresponsive. The first thing you must think of is she pregnant? Is she pregnant? Okay, as a doctor, as a common citizen, you see a young lady, fit, healthy young lady, collapsed. The first thing you must think of is she pregnant? And if she's pregnant, she's likely to be having ectopic pregnancy and she's near death. You must rescue her. Okay, and how do you do this? Okay, listen attentively. Sometimes in the hospital, they're able to pass a catheter and get a quick urine sample from the woman, and we do a quick pregnancy test. Okay, that is if she's in hospital setting. Okay, and that test come back positive, 2 lines. Open a line, put a line in the woman. The nurses or doctors put a line in the woman and start passing fluid. Take blood, cross match 4 units of blood, send it into her. The reason that woman is bleeding in the tummy, she's been bleeding for at least 2 days. And the tummy is so big enough that can contain at least 5 liters of blood, and the tummy is not distended. A fully grown woman contains at least 5 liters of blood running around the circulatory system at any point in time. And the tummy can contain up to 5.5 liters of blood, and the tummy is not yet even distended. That's how big the tummy, the abdomen is. So you see this young girl, she might be complaining of stomach pains on few days and feel dizzy, and she collapses. Trust me, that woman has ectopic pregnancy until proven otherwise. Rush her to hospital. They must do a urine test of pregnancy from her. If she's collapsed and she's not producing any urine, just pass a line in her, pass some fluid into some normal saline, take blood and start conspiring blood for her, and send that to the theater quickly. Open her. Is possibly there's blood in the tummy, or if you have access to a scan her quickly. Okay, and what I'm saying this is that many women have died untimely because doctors and people around women fail to diagnose or suspect ectopic pregnancy. Ectopic pregnancy, whenever is happening, it means the pregnancy is outside the womb. It's in the tube or on the ovary or elsewhere. Okay, only the womb is designed to sustain pregnancy till term. Most cases, ectopic pregnancy usually is in the tube, and it will rupture the tube. And the tube, the blood supply to the tube, okay, is a branch of the uterine artery, and it flows and beats blood per second. Okay, and a woman can bleed to death when the tube rupture. The blood supply of the tube is a direct branch from the uterine artery, which is from the aorta, and the aorta pumps blood like no man's business. And a woman that has ectopic pregnancy and the tube ruptures can die within 2 days if it's not attended to, because the blood keeps like a pop, 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 like an open tap. So my topic today, as I said again, is when there's ectopic pregnancy at the same time with a normal pregnancy or any pregnancy in the womb, it is called heterotropic pregnancy. And one of the commonest reasons why people have heterotropic pregnancy is that they do IVF. Now, I'm not saying because you do IVF, you're going to have that sort of thing. Many women have pregnancies naturally, and they do also have ectopic pregnancy and normal pregnancy in the womb. But with the advent of IVF techniques, okay, artificial reproductive technology, IVF basically, the incidence of pregnancy in the womb and outside the womb has increased. Now, saying that doesn't mean that you should not have IVF. Okay, I've done over 1,000 IVFs. Okay, and I've only seen one ectopic pregnancy so far. Okay, so the incidence of ectopic pregnancy is very, very rare, up to 1 in 100,000. One patient out of 100,000 IVF will have ectopic pregnancy. One patient out of 100,000 pregnancies will have ectopic. So it's so rare. If you put 100,000 women together that have pregnancies, only one will have ectopic pregnancy. Ectopic. So it's so rare. But with the advent of IVF, it's gone up to 2 in 100,000 women. So it's a bit increased, but it's still so rare. Okay, but with IVF, Clomid, all these things, they increase the incidence or the chances of suspecting ectopic pregnancy and ectopic pregnancy. I've seen a woman that was here 10 years ago when I was in this place I'm working, and I've seen one last week too. She had IVF. She came in, her tummy was painful. We did scan, blood in the tummy, and we can also see a pregnancy in the womb. There was so much blood in the tummy. Obviously, we went in with the camera, and obviously, whenever somebody has ectopic pregnancy, we take out that tube because that tube is damaged. If you don't take it out, she will have ectopic pregnancy again. So we took out that tube, cleared out this blood in the tummy. But the pregnancy in the womb is fine. It continued. The one I saw here 10 years ago, we had to do a D&C because that pregnancy in the womb tube miscarried. So we took out the tube, took out the pregnancy in the womb, D&C. But this one I saw last week, okay, she lost the tube because the blood came out from that tube, the right tube. She bled about 1.6 liter of blood. She bled for about 2 days because she was feeling uncomfortable for about 2 days. Scan, blood, tubes out. But the pregnancy in the womb for this woman last week was okay. The pregnancy is now 6 weeks, heartbeat is okay, she's fine. This is common with IVF. So if a woman has IVF, you do scan, you can see fluid in the tummy, it's probably ectopic pregnancy because you wonder, but during IVF, we put the pregnancy directly in the womb. How come it went into the tube? It can happen. And sometimes during IVF, you put the one pregnancy, they multiply, divide into 2, and they can retrograde and move out of the tube, because it was put there. They can move out of the tube and enter into the ovary and implant there and cause ectopic pregnancy. So IVF itself, despite the fact that we are putting the pregnancy directly in the womb cavity, they can also move. That is why during IVF, techniques matter. During egg transfer, once you've put in the egg, we leave in the transfer catheter for a few seconds. We don't move, and then slowly we withdraw. Putting and moving quickly can make the pregnancy shift. It can happen. So when you put the catheter during the embryo transfer during IVF, we leave it there for a while after releasing the egg, and then we rotate a bit to the left, to the right to make this sit down in the womb cavity before pulling out. Even despite doing that, some people, it will still move. Okay, it will still move. Sometimes when you put more than 1 or 2 eggs, more than 2 eggs in the womb cavity, they can move. Okay, and one moved into the tube and caused ectopic pregnancy. It's common, but it's so rare yet still. Like I said again, on a normal scale, without IVF, 1 in 100,000. With IVF, it moves up to 2 in 100,000. So it's still rare, but you must be aware of it. You must suspect this. You see a young lady, no IVF, collapsed on the floor. Think of ectopic pregnancy first of all. You see a young lady, a middle-aged woman, done IVF, having bleeding. She's done test of pregnancy, is positive. She's still okay. She's having tummy pain. You scan her, blood in the tummy, ectopic pregnancy, and pregnancy in the womb confirmed. Remove that pregnancy in the tube. She needs it out so that she can survive. And how do we deal with it? In most cases, if the woman is unstable, she's unwell, she's collapsed, we have to open quickly with a tiny incision, mini incision in the tummy, drain out the blood, and take out the damaged tube off. And we leave the pregnancy in the womb alone. We scan again in a week or 2. If it's okay, continue. If the pregnancy is not continuing in the womb, then we do a D&C afterward, because we don't want to do D&C at the same time while taking out the ectopic so she doesn't lose both. We take out the one in the tube that is damaged. The one in the womb, we leave it alone. Scan again in 2 or 3 weeks. See if it's okay. If it's okay, lovely. And this is what I was saying some few last week or so. Did a scan today. Pregnancy is fine. She's good. So it can happen. It's rare, but it's still possible. You need to watch out for it. I know I've not mentioned names today. I've been going up and about, talking to the camera of our Instagram camera, but I'm live on Facebook. I'm live on YouTube. Definitely, you're going to have questions. Now, I'm not saying you shouldn't do IVF. IVF is good and it's necessary for a lot of people, and it's a life and a game changer for many women all over the world today. Good evening, doctor. What is the success rate of IVF in my clinic? In our clinic, IVF success rate is about 75%. If we do 4 patients, 2 or 3 will get pregnant by God's grace. Now, but having said that too, I've seen sometimes we do 4 and none pregnant. There are many factors. Some people, they need egg donor to be used for them, and they will decline. They want to use their own eggs for many reasons, religious and personal reasons. And in those cases, you know that it's not likely to be positive. And for those people, they accept that that's their choice and they're okay with it. For people that have, so I've seen many women that are not ovulating anymore. They came from overseas. They know that they're not ovulating anymore. They've been told this already from overseas, and they know that they're going to need egg donor. They accepted and they did egg donor and they got pregnant. So a lot of factors come into play when you're talking about IVF success rate or not. It depends on the factors that the patient have, what we recommend to them, and other factors too regarding the laboratory, media, culture, people following instructions, and the transfer technique as well. All these things impact on the overall success of IVF in any center. Okay, so in any center. So it's not just a reason. Say, oh yeah, a lot of things come into play. Sometimes patients don't accept or agree with our recommendations. They want to do things their way, which is acceptable, is a free world, and then they have issues, no success. That's fine, and they accept it. Thank you, my wonderful sister, Mrs. Johnson, for joining today. Charlie T, Oneron, Isoni, Obemudia, or Dion. If I've missed your name at any time, I'm sorry. I will capture your name at some point, maybe later when I'm going through all the information again. Yeah. Once again, this is Dr. Lalade, one of your admins at Ask the Gynecologist. I'm still talking, so if you have any questions, please ask your questions. I'll answer them. I'll answer them as soon as. If you have any questions, ask them. I'll answer them, and I'll ensure that you get good answers and response to whatever is bothering you or your questions that you have. Richard Dominion, good evening to you. Gbemolala, thank you, Mrs. It's Iluebubebutu. This is very. Thank you so much. I am Aolat. Thank you so much. And good evening to you, Anang Delphin. Delphin, thank you so much for joining on YouTube channel. Thank you so much. Cecilia Alewi, thank you so much. You too. Thank you, Cecilia. Rita Tosi, good evening to you. And to all our viewers all over the world, even across Philippines, across Japan, good evening to you. Will the lady look like the mother in any way? Okay, so now there's a question here on YouTube that if somebody had IVF and she used a donor egg, would the baby look like the mother? If the egg is not from the mom, it will look like the mother. Now, if the egg, the donor egg that the woman received, is from maybe a sister relative, the chance that it might look like the mother, but I can't guarantee that. Now, so related, not genetically related, and it's going to look like the mother. The only way it's going to look like the mother is if the donor is a black person. The baby will be black too. Other than that, nothing. And then if you are trying to choose a donor, you say because you are dark in complexion, you want somebody the donor to be dark, yeah, it will look like it because you're dark. You want the donor to be fair, yeah, it may look like you because you're fair. Other than that, all those phenotypical characteristics are the only thing that you get. But the genetic link, no. Yes, Cecilia, you are free to ask questions, please. Cecilia Obori, thank you so much, Cecilia. Thank you so much, all our Sam Makinde, Cynthia. Thank you for joining. These are our team members. They are in the background monitoring things. So special breed. I've answered your lovely special breed for that wonderful, thoughtful question. I really appreciate that. Thank you so much. Because a lot of people want to ask questions. They are shy. It's good when we ask questions. It helps me even dig in deep and to get points clearer to you. So it's very good if you ask questions. And thank you so much For those that have asked questions, you're bold enough. It's good and it's commendable. I appreciate that. Thank you so much to you and good evening. So Cecilia, Lewy on YouTube, please your question, crack on. Let me take it. Let me take a question. Good evening to you. Thank you, sister. Thank you, special. Adiola Idowu, wonderful lady. So I think you got a question there. So I'm free. I want to take a question. Let me take a question now and let me answer them. Chika Benson. So now at least you understand ectopic pregnancy. You understand heterotropic pregnancy. People ask me, what will make a woman have ectopic pregnancy? There's a question here. You're not menstruating after you had your first child. What can you do to have children? So if you're not menstruating after your first child, are you still breastfeeding? If you're still breastfeeding hourly and on demand, that could be the reason. Did you have any contraception on now? If you do, that could be the reason. Are you stressed out? Because that could cause hormonal imbalance. Have you checked? Was there any complication during your delivery, C-section? Was there any post-op complication like infection that could have caused issues which you not be able to get pregnant? Have you checked your husband's sperm? Maybe there could be issues. Okay, so all this you have to check. Check your hormonal profile. Check your AMH. What's the distance between your first child and this your and now? How old now? I mean, what's the distance? Latubo Abina, Oge, Grace, Michelle. Thank you so much. So 4 years ago you had your last child. So how old are you? So lifestyle changes, weight gain, BMI, maybe you have polycystic ovaries. Check your hormonal profile. Do ultrasound scan. Check your tubes. Can one know the genetic history of a donor? You can. But in most cases, in a small sentence, if you want to know the genetic history of your donor has to be informed that you want to know. And if donors obviously has to disclose based on your request, they might ask to know who you are too, because they have that right. And most people that are recipients may not want to disclose their, who they are, their identity to their donor. And in that case, we leave it alone. We go in between as a broker. We know the donor. We know you. You tell us what you want, color, height, this and that, and that. We match them. Case closed. Okay. Now, you want to know genetic history. I'll deal with a lady. Okay, Keith, thank you, Basharat, for coming today. I did CS to have my children. So if you had the cesarean section, was there any complication? So all this I've mentioned to you, Cecilia, you have to go through it to know why and what's happening. And are you having regular sex? If you're having regular sex, that's okay. But are you having regular sex? A lot of people trying to get pregnant, they're not having regular sex, and that could be a reason why they're not getting pregnant. So I was discussing with a lady recently, about 12 months ago. She was asking me about getting donor at her center for IVF, that she wants to know the donor's psychiatric history, or whether the person is mentally stable. So I said, how do you know if I'm mentally stable? How do I know if you talking to me are mentally stable? It was a joke though. She laughed. It was a joke. No, it was the way we were talking was a joke anyway. So I'm like, in actual fact, as far as the donor has no communicable or infectious diseases, viral infections, HIV, hepatitis AB, hepatitis C, VDRL, syphilis, and all that, and the person is clear. The person is in your match, blood group, genotype, and all that, height, complexion, what the things you want. Okay. Psychiatric history and all this, they are multifactorial. Yeah, they are multifactorial. Some people are okay. Put them in a bad situation, they become mad, they become crazy. Okay, so you can't predict how humans will behave until you put them in an uncomfortable condition. And everybody got something in them that can trigger craziness. I'll put it that way. Obviously, we won't get a donor for anybody that is crazy, you know what I mean? But what I'm saying is that, such things you can't really know much. So as far as the donor hasn't got any infectious stuff, which we'll screen for, you'll see the results. And the person hasn't got obvious psychiatric problems. I mean, obvious things like schizophrenia and all that. And the person has got no other issues that are chronic. Okay, and the person is matching your phenotypical characteristics. That's fine. and then you want to know whether the person has got any medical concern like chronic stuff, that are problematic. That's all you need to know, to be honest, because every other thing is multifactorial. Trust me. Okay. And any other thing you want us to check in a donor, we check according to your request. Okay. Yes. And maybe you want to check whether they've got some particular medical history or chromosomal or genetic problems that you want to screen for. Yes, we can screen for them, but those will carry extra cost, because depending on what you want us to screen for, they'll carry extra cost anyway, because they are also different things. So we do that for anybody that requests. It's up to you. Yeah. Cecilia, you can chat with me privately. You can go through our consultation links. We have direct consultation link with me, doctors, and I can consult with you free of charge. Other than that, you can ask questions here freely. Well done, doctor. I had my baby 3 years ago through cesarean section. Recently went for a scan and I was told my left ovary was shifted up. Could this be why I've not... No. So your ovary is tilted or shifted up. Can that be the reason why you're not pregnant? No. As far as you're ovulating, your tubes are not blocked. The ovary release egg, the tube to pick up the egg anywhere they are. The tube is able to pick up egg anywhere they are in the body. I mean, in the pelvis. So once you release egg, the tubes know where to pick them. They have like a GPS system. They'll read that. They'll figure the egg, shoom, they'll sweep it in, and they suck it in, and they sends it into the womb. Okay, it's like a suction pump. Shoom, they just pick the egg. Shoom, shoom. How can I know your hospital name? My hospital name is ATG IVF Center. Don't worry, one of our team members will post. Don't worry, on this page, YouTube page, one of our team members will post the link for our center and a phone number shortly. Okay. Adufe, thank you so much. That's it tonight. I'll be logging out. You can watch the video over and over again at your own free time. Jeboda, thank you Tosin for joining tonight, and share the video with your friends, so they can know what we've talked about today, and they will see you soon, hopefully once again. Alalade here, your doctor at Ask the Gynecologist. See you soon. Have a wonderful weekend. Bye bye.